get closer to that light at the end of the tunnel.
All right. Thanks, John.
Thank you, John.
All right. Thank you, guys.
There you go, John Fernandez,
Hey, look,
DOE
He
Superintendent.
needs to get a beer this weekend. Just chill. He's so busy.
Hey, 9:28. Let's go over to the phones where we have the education chair of the Guam legislature, Senator Telena Nelson, on the line. Good morning, Senator.
Hi, good morning, Chris. Good morning, Sabrina.
Good morning.
How are you guys doing today?
We're
Good
doing
morning, Will.
we're doing very good. So glad you could join us, Senator. Thank you for coming on.
Yes, thank you. Yeah, I just wanted to touch a little bit on the roundtable hearing we had Tuesday night, and I think the superintendent pretty much summed it up. You know, there were concerns with the way the frequency of the testing was being handled, and so we had this opportunity to allow those teachers that are it's very prevalent that they're experiencing undue stress because of this extra mandate to get tested weekly if they're not vaccinated. In one instance, we had a teacher that quit her job, resigned from her job, because the mandate she felt was very difficult to, and also the reasoning and the logic we were trying to clarify with DPHSS why the frequency was a week. And you know, there are some agencies that people spoke about that they're not being tested weekly, and so really it's just a matter of seeing if we asked DPHSS to take a look with their technical team, their MedOps team, and to see if they can adjust the frequency of testing. It was also brought up that the COVID-19, that if you contract COVID, that after 90 days you'll get tested again. So we were just kind of understanding the logic and some of the questionable actions in the mandates of the testing itself.
So it sounds like he just kind of walked away with even more questions.
Right, but we do have some areas that we would target, right? And so we asked DPHSS to meet, and they meet every Monday and Friday, and so we're going to follow up with them next week and see what the resolve is as far as the frequency of the testing.
What was their response, though, when that question was posed?
That really all I got from it was just a decision that they made, and that they recommend to the governor, and then the governor issues the mandate. And so in some government executive branch agencies, there's not this type of requirement or it's not enforced where they're testing weekly for those that are not vaccinated. And what was really surprising, but it was not said at the roundtable, but it was put in the chat in the forum that we had, and it said that there are 148 employees that also feel the same way, but they're afraid to speak up as well. And that's understandable. So that was one thing is we're looking to change the frequency of testing. I mean, I don't understand why, we are testing them with expired kits in the first place, even though that they were approved to go ahead and move forward with testing with the expired kits as far as what was the manufacturer's statement, according to Mr. Chima. So we will see by next week what they would decide on that case. And I understand that I understand the position of the superintendent having to follow through with these mandates, and I respect that. But if you have a good part of your certified teachers who are struggling with this, especially during a teacher shortage, there is the opportunity to speak up and say, can we transition? Do we have to do this weekly testing? It's causing undue stress to them, and we talked about mental health. We've been talking about mental health the whole COVID-19 during the whole pandemic. We've been asking GDOE to reach out to the students and seeing how their state of health was. And so this is not something new. This is something that we've been pushing since the pandemic, and I'm glad that they're taking steps to address the issue today, and that's something that shows that we're heading in the right direction.
What were you satisfied when you heard about the exemptions, right? The religious exemptions. I think that's what was it, Bruce, that kind of brought up at from Southern High School, and the fact that he said that he had submitted the paperwork, and then when he followed up, it wasn't even there. And
yeah, so and we did ask DPHSS, and so they had some challenges, ensuring that the legal aspect of these exemptions were complete, and so they do have exemptions for other vaccines, but just not for the COVID vaccine. So this is something that they needed to process. But my concern was, okay, so now that you're trying to figure it out, it's been several months already. Can you please expedite this process? And if teachers had to take leave, or if employees had to take leave, we asked the superintendent, perhaps one of the things you can consider is reimbursing that leave. And it's not an unknown practice, especially in the federal government, when they furloughed employees. When the money came in, they just went ahead and paid them the days that they were furloughed. And so, these are some of the accommodations that we can make for these teachers. And in some instances, some teachers who are not vaccinated, it's their day to test, and they don't feel like testing, and so they'd have to wait another week. So then they're missing in the classroom for a week. But if teachers feel the next day that they're mentally ready to test again, to get tested for COVID, and they're not vaccinated, they should be afforded that opportunity. But that opportunity is not there for some of the teachers in their schools, and so that's something that we're also working towards.
There was a parent, Sam on. He kept on pressuring Chima about this CT level. Do you plan on, I guess, following? There's a question here. Do you plan on looking further into that?
Yes, absolutely. So the CT threshold was between 45 and 48, and so really the question was, what has been the CT for the past 18 months? And so we're going to follow up on that. It was something new to me. We actually had to research, and we're still reading up on it now, on the importance or the relevance of what CT is, and why is it important, and what would be the right number that we should be looking at, or calibrating the machine to detect. And so we are following up with that with DPHSS for the past 18 months. What were their calibrations of CT? Okay. Yeah. So we're trying to make some movement. We're working with DPHSS and GDOE to ensure that there's no discrimination amongst those that are not vaccinated, and that seems to be the crux of the matter, is that they feel that they are singled out. They feel that it's a coercion technique to get tested weekly, so that eventually they will get their vaccinations. And I also inquired, what is the percentage threshold that you will say, okay, you don't need to get tested? If more than 90% of Guam's population has already received the vaccine, what is this threshold where you start lessening the restrictions on those that are not vaccinated? And they're still examining that, and I think that a lot of their efforts have been used also to advocating for the child vaccine. And I specifically stated to the superintendent that I hope that if they start pushing a mandate for the child vaccine, that they need to get input from the teachers and all of their employees, and also from the parents, because we've had a lot of parents call our office or even visit us and say, I don't want to vaccinate my child just yet. We don't know the long-term effects of this vaccine. And so, that's a concern too. So before those decisions are made, and I'm hoping that they don't move forward with the mandate until they get the whole public to understand really what the vaccine will do, and to get the voice of the parents to see if, they're in agreement with it. A lot of them are worried that they're going to get that their children will get either tested and vaccinated without their consent. And so we just want to stay alert and stay vigilant to ensure that those types of mandates do not happen without public consent or without parental consent.
All right.
Okay.
Thank you so much,
Thank
Senator.
you. And we will be having an oversight hearing. So we will be having an oversight hearing on GDOE's finances on December 15th, I believe, at 10 a.m. Only because, it's the second month and they're already claiming a shortfall. So we're just trying to understand with the $283 million they received extra from the ARP and then another $100+ million coming down from the infrastructure bill. And then the CARES 1 and 2, where did all the money go and why in the second month of the fiscal year are we saying that there's a shortfall when, we appropriated them for their maintenance of effort? And which was interesting because we were calculating a higher number and GDOE came with a lower number. So the Office of Finance and Budget went ahead and said, okay, this is the number you're giving us. So to meet your maintenance of effort, and that's just curious too because we've asked them if they've sent any request for a maintenance of effort waiver, and I don't believe they have. So we're just going to have an oversight, try to understand where all the money is going and how it's being spent.
Well,
all right. Yeah.
We'll look forward to watching that.
Bring your magnifying glass.
Yes.
All
right.
Thanks,
you very
Senator.
much.
Merry
Have a good day.
Christmas.
Merry Christmas, you guys.
Yeah.
Merry Christmas.
Senator,
Bye-bye.
let us know if you want to come back and Christmas Carol before Christmas because Jason's still
You're a
talking
good
about your
singer.
singing.
Yeah, Senator, I keep telling everybody you have a lovely singing voice when you let us in the Little Drummer Boy.
Oh, you're so kind. Thank you. Have a good day, you
All
guys.
right.
Senator.
Bye-bye.
Bye.
Bye-bye.
You're so kind, Jay. It's 9:40.
It's what we do here on the
It
show.
is. We do kindness.
You know who's kind too? Our friend Samantha Titan.
Yes, she is very kind.
Yeah.
Especially if we're holding on for so long.
Yeah, I was going to say, she's got so many virtues to her. She's a great leader. She's doing wonderful things with the community. And she's incredibly patient,
Yep,
as we
that's
see.